In 2020, some Americans are not getting the medical care they may need. According to a recent survey of over 5,000 American adults, approximately 41% have delayed or avoided medical care, including routine and emergency or urgent care, as of June 2020 this year. Now, if Americans continue to delay routine care appointments, we may see a decrease in early detection of new medical conditions, potentially worsening outcomes. A new educational campaign, No Time to Wait, has launched in part to raise awareness about symptoms of atrial fibrillation, if I'm saying it right, AFib, the most common type of irregular heartbeat, and talking to a doctor. And here to explain why it's so important to learn about the potential associated symptoms of AFib and talk about the campaign are cardiologist and immediate past president of the Heart Rhythm Society, Dr. Andrea Russo, and Jackie, an AFib patient. Good morning, ladies.
Good morning. Thank you, James.
Good morning.
Now, Dr. Russo, what has recent research suggested about people receiving medical care this year?
So, a recent survey of over 5,000 adults in the United States showed that 41% of individuals are either delaying or avoiding medical care. And this could be a problem because we're not getting at things early. We need to hear about symptoms early, and we need to have people seek medical attention early.
Now, why is it important for people to learn about symptoms that may point to AFib?
So atrial fibrillation, or AFib, is a very common irregular heart rhythm. And this can cause symptoms of palpitations or heart racing or shortness of breath or lightheadedness or dizziness or even sometimes chest discomfort. Now, these symptoms can also be due to other things, so you need to tell your doctor about your symptoms so you can figure that out. But atrial fibrillation increases the risk of stroke by approximately 5 times. So it's really important that you tell your doctor about symptoms.
Now, Jackie, can you tell us about your experience with AFib and what symptoms you had and how you decided you should seek medical care?
Well, I've always had some racy heart thing with exercise, but I noticed one evening my heart was racing when I was in bed, and it only lasted a few seconds. So it was kind of easy to dismiss, but I decided when I went to my wellness check to talk to my doctor about it, just to tell him about the change. And he asked me to have a cardiac stress test. So I had that cardiac stress test, and when you do that, your heart rate goes high because you're under exercise. And what happened to me is I could not get that heart rate to go down. So they actually had to use a little electric shock for it to go back to normal rhythm, and then asked me to see a cardiologist, which I did see. And I was so thankful that I saw the cardiologist and I paid attention because I did not know about the increase in stroke risk. So I was very thankful I went to see my doctor.
Now, Dr. Russo, what is the No Time to Wait campaign all about?
Well, the No Time to Wait campaign is a educational or awareness campaign to let individuals and patients know about atrial fibrillation. And I'm partnering with Bristol Myers Squibb Pfizer Alliance to be part of that, to get that message out. It's really important for people to know. Even, Jackie's story is a classic story of atrial fibrillation, and people need to know even mild symptoms should be reported to your doctor so further investigation can happen.
Dr. Russo, interesting question. How important, if you have this situation, is exercise, especially cardio exercise?
Yeah, so exercise, in general, is a good thing. It's a good thing for your heart in general. But if you're having these symptoms, you really want to report them right away because your doctor may, tell you whether or not you need to exercise or not right now. But you want to be able to exercise for the long term. So really report your symptoms and ask your doctor about your particular situation. Everyone is really different, so you should really tell them about you.
Jackie, one last question for you, or actually the second to last question. Tell us a little bit about your electroshock experience.
To be honest with you, they gave me a little sedative, so I have no idea what that was about. I passed through the treatment with flying colors. know.
So, so, so Dr. Russo, yeah, we're all laughing at this. Dr. Russo, so you tell me, while she was passed out, what did the doctors do?
Well, every patient is different. And so what we really want to do with this campaign is to get that awareness out there, because some people may undergo what Jackie underwent, and other people may have other recommendations, and everyone's different. And we really want to, center our care around the particular patient. So please, please give out that, information to your physician. Don't delay evaluation.
Jackie, now where can our viewers go for more information?
Well, please visit the website notimetowait.com and look at the symptoms, the education, and please go to your doctor.
And Jackie, I'm so glad you weren't passed out during this interview. It's great to have you here.
Thank you.
Dr. Russo, Dr. Russo and Jackie, thank you for joining us on Morning Blend. We really appreciate it.
And thank you so much for inviting us.
Thank you.